Today we are at the DMEA conference and we're gonna report on our highlights, learnings, and what we learned from the larger startup scene in digital health. The DMEA is a conference, or I should rather say exhibition or fair, that is in the context of digital health. So we have a lot of solution providers from um, clinical administration software to med tech to even cloud providers. You have startups, you have pharma even coming. It's a big, big conference.
Yes, this is one of the leading European leading conferences, and it has more than 18,000 participants, 800 exhibitors, and 300 speakers. And according to the number, we actually have 15% more people than last year. So it signals how big it is and how bullish the industry is.
Yeah, it is in fact growing year by year. On the first evening, they highlighted it,
Yeah.
and I was actually surprised. But I didn't know that, to be fair. But did you notice that this year was more buzz than last year?
Yeah, I did. When I came here, I realized that there are more rooms that they opened. So we are at the Messe Süd in Berlin. So they have a lot of rooms. We are on the level second. So they open different wings because they have more participants and more exhibitors this year.
Yeah. So let's focus on what we can share about this.
Yeah.
So we wanted to share our perspective because we came the second year having the little tiny startup booth that you see, and we were exhibiting for 3 days. This is the third day. It's the closing day. It's already afternoon. You can see at the back it's already thinned out. Many people have gone home already, so we use these rather quiet times now to record this.
Yes.
And want to share how we have experienced it, being an exhibitor, but being also in conversations with other startuppers and other people from the larger industry, and so on and so on. So take this as of
Our own opinion and perspectives. So we will share based on our experience, and we are not related to any brands or any companies that we're talking about. We are only sharing this experience for the participants and attendants who are interested in this event.
yes.
Let's
Let's
go.
start with our highlights. So, Soraya, I ask you, what stood out for you?
I think I already mentioned that. So we were here last year, and when I saw that they opened more wings and they have a lot more exhibitors, I feel that there's a lot of confidence that people are putting or investing in digital health. So it just felt different. And I think for the startup area, it's slightly bigger. It's not we're actually in the same place, but it's slightly bigger. And there are one of my highlights. The second highlights is that we also met the same startups. Some of them, not a lot, not all of them, and it's really interesting and very amazing to see what 1 year could bring to the founders. And yeah, I'm very excited to see our fellow founders are growing, the products are growing. Yeah, ecosystem is emerging.
Yeah, true. Progress. My highlight is actually the progress on our end and what we brought to the conference. You see this um, tacky poster that we designed, and we had a lot of activities. So we tried to
Yeah.
share all of our free freebies,
Freebies.
be it the prompt engineering course, or be it the lucky draw that we have done with these Easter eggs, and in general how well it worked for us to represent like true colors. So
Yeah.
being authentic, because for us, digital health, or let's say the healthcare industry, is
Hmm.
not the predominant focus. We
Yeah.
come from the pharma environment, um, so healthcare is related to it, but it's not the particular focus for us, and we have other engagements that are outside of this. And then telling the people that, all right, like, healthcare is slow moving, it's conservative, so therefore, like, it's something that we try to use as, okay, we bring our innovation to it, but it comes from somewhere else. People understood that.
Yeah.
They liked that we opened up, and I had a lot of great conversations, really.
We had a lot of great
Yeah,
conversations.
but it started with, or it rooted in this representation of ours. I think that that was more authentic than last year, and this was my personal highlight, which just really relates to how I have perceived it.
Yeah.
It's rather personal.
Yeah, yeah, yeah. Well, do you want to share a little bit on what we did
Uh,
beforehand?
yeah. So what we did was, like, we played around with like the idea of, can we use Gen AI in a fun way
Yes.
for this overall a experience of ours, and yeah, just be playful and foolish a little bit. So we asked a Google Gemini model, but could be any big model, to put together a marketing plan for us as we are exhibiting at this conference.
Yeah.
And we're going to share the details about it in a separate
In a
video.
different video.
But the larger idea was, like, what do we know about marketing? And maybe we have some ideas, but potentially not the best. And so we asked Gen AI to be a marketing genius for us and prepare a plan, and we will just close our eyes and execute. And
Exactly.
in that regard, like, some of these things that you see here were at least inspired by, if not directly instructed us to execute by Gen AI. So
Yes.
that's why, like, we also put like a little tag up there, like, this booth was created by Gen AI.
Generated by AI.
Yeah, so
Yeah.
that was funny. Yeah,
But I think that during the process, we also put the limitation that we didn't have so much budget, and we needed to come up with different types of marketing strategies. So, like for example, this kind of decoration is like
one
€1.
euro.
Yeah, and then we came up with this egg. Like we designed and did it ourselves for like
Minimal cost. Yeah.
minimal cost. But this is the art of doing it while you're being young as a company. That money is not always there for your marketing, but it's already good to be at this conference because we got a lot of feedback, we got a lot of engagement, and this is why we're here.
Yeah,
So
yeah, it was fun. It
it
was
was
really
fun.
fun.
That's
Yeah.
like also one of my highlights preparing that. Also the website.
Till 2 a.m. in the morning. We're
Yeah.
not gonna lie. We're not gonna lie. Till 2 a.m. in the morning, the day
Yes.
before the conference started.
Yes, and we embedded the egg as well on the
Yeah, on the
website.
website, all
So
these things. Yeah,
all
last
this
minute
thing.
stuff. Yeah, it is the
So
way it is. It was fun though. It
it
was
was
fun.
fun. It was
Yeah.
fun.
All right. So with all of these highlights that we shared, some learnings potentially have directly emerged from that, or came from other inspirations or things that we have experienced.
Yeah.
Do you want to share a learning from your end?
The learning is to register as soon as possible, so then you will get the prime location of your booth,
Yeah.
because the if maybe you cannot see it from here, it looks like a triangle here. So people are coming from that side and we're in the prominent area. So I think that that was one of the highlights. I wasn't sure whether we wanted to be here or At the first, at the first place, as founders,
Yeah.
it's not a trivial investment. I would say it's quite a lot, but we decided to do it anyways. And when we were preparing until 2 a.m. in the morning, we thought, we don't know where we're going to be, and boom, we're on the very front of this area, and I think that was such a great thing.
Yeah. I mean, last year we already said to the organizers, we want to come again. It was
Yeah,
so great.
yeah.
They had us in their mind, and I think Soraya's like
Please, please,
best
please.
friends with everybody that she met one time. So the second time is
So
already
we're
feels like
trying,
family.
trying
So
so.
so that was really fun.
Yeah.
Yeah, yeah, that's a good learning. That's a good learning.
Yes.
Um,
Yes.
the learning that I take away from this time was to ask for feedback directly. You have like what is special about these type of fairs and so on. You get to talk to people that you potentially don't get to talk to in your day to day.
Yeah.
If you ever get to talk to people
Yeah.
regularly at all, right? So take advantage of that as much as you can to ask for people's feedback. Whoever comes, really, because
Absolutely.
we had people whom we thought they just want to sell something to us. Of course, right? You have salespeople
We
going around,
are
so
everybody selling everything.
exactly, but it doesn't matter. So many people who came here wanted to sell something to us, like we got into a very fun conversation after all. So
Yeah.
they can share their feedback, we can share our feedback,
Yeah.
and then you sort of part ways, you shake hands, and
Yeah.
both parties have something that like found something surprisingly interesting,
Yeah.
and that happens all along. But it won't happen if you don't set out with the goal of generating feedback for whatever you want to bring and present.
I agree.
And for us it's services a lot. Some people who are watching out there, they have like concrete products and so on. It's easier
Demos.
to
Yeah.
demonstrate and then ask people, hey, how you like this, how you like that.
Mm-hmm.
But even if you're just like us, a service company, you can do that.
Yeah.
And I, I enjoyed it a lot, and it was a big learning for me. Like I will not forget it in a long time.
Yeah, and I think adding to that point, we got a lot of types of participants and attendants at our booth.
All right, thank you for the learnings, and now let's talk about our neighbors here, the other startuppers. And I have a very open-ended question to you. In fact, what's your perception on what the other startups doing, the larger, like let's say, startup or innovation vibe in this industry? Tell me.
Well, my own perspective is that because we were here last year and we have seen our neighbors, now the neighbors are, some of them are the same neighbors and they have developed a lot. And I think, to me, the learning is that it's so much that founders can do or you can bring within 1 year. And I'm very happy to be in this journey and also to see our fellow founders and ourselves to grow that much. Yeah.
Yeah, that's cool. Um, I am also happy. Like we had some great conversations, and I want to share a little bit from these conversations. Before that, maybe a little bit of background from perception of last year compared to this year. This year, everything's like AI everywhere. I mean, we're also part of it. So um, yeah, but last year, how was it different? It was more about the more classic AI, not so much generative AI. And this year, with the startups, I see more Gen AI
Gen AI,
applications or Gen AI enabled applications where you have like chat assistants for patient support and so on, and
which is pretty
text,
cool.
yeah, text processing also to help in text heavy processes in the administration end. So you see that alongside to some med tech, but not so much. So that's really cool. I appreciate that. And at the same time, how is the startup area different to like the industry incumbents? Um, The industry is in general relatively conservative, slow moving, and the systems that they are using are like truly stuck in the 80s. Yeah, like they, I mean, like I can't help to
Maybe
say
90s.
anything else than they look like printed out spreadsheets. And it's they also these incumbents put AI on every poster that they have. But once you engage into a conversation with them and you ask them like, "Hey, what is your AI actually all about?" And then they would be like, "Yeah, it's something like an optimization, a little bit of an algorithm, like a little bit of a regression here and there." And then you'd be like, "Right, okay,
Yes.
that's not so cutting edge, is it?"
AI
And therefore you see the more innovative stuff here.
at
That's
the
good.
startup
That's good.
areas. Yeah.
And at the same time, if you talk to those who provide these solutions, some of them really enthusiastic. They just started, they want to get going. And particularly those that we met last year, you also hear some frustration. And it is that things just take way too long. Decision making and approval processes, particularly at hospitals, where they wait 3 to 6 months just to get a virtual machine up and running to host the application. This just doesn't make sense because those startups, they don't have endless or limitless time. And at the same time, you hear the critique from the hospitals that they don't want to work with startups because, well, they could be gone in a year. Well, why do you think they're gone? Because you're so slow moving.
And
So
nobody's buying the solutions and allow them to also test the market,
yeah.
right?
So this is something that I feel like doesn't make sense. You want innovation, you want the best support for doctors and nurses, those who I think we would all agree need support, need the best tools, need the best systems, because it is in our own interest if we're sick, if our loved ones are sick. And then at the same time, we are totally okay that they work with such anything but optimal systems. A lot of manual processes. It's like it's crazy what you hear from. Like we are also talking to some doctors and like people that are like let's say practitioners in the medical industry. They came also to our booth and we also had conversations, and it's crazy with like what stories they have to share, and you
Yeah.
really wonder like how is this even possible,
Yeah.
and how are the hospitals okay with accepting to buy these systems that they are buying. I don't understand. I really don't. I want to be open and everything. I don't understand, and it's also frustrating to me, because then I can really empathize with the other startuppers here, with their frustration. And yeah,
Yeah, I think
it's
we're
not nice.
in a bigger ecosystem, and I think there's a lot of progress and a lot of trailblazers as well. So people who are coming from the disciplines of healthcare, pharma, traditional ones who try to move the needle, and I've seen that as well at Health Tech conference. A lot more conversation to move the needle. We want it, but I think the larger adopters, they are not there yet. So hopefully, if you listen to this, you're part of it. Let's move this industry to a lot more transformation, technology transformation, where we can help our community make a better, healthier community through technology.
Yeah, I like this strong word towards the end. um, I can
Yeah,
from my end, I cannot hide that it's frustrating me, to be
I will.
fair. Yeah.
I think everybody's frustrated because it's somewhere it's not bridged this frustration because solutions are already there. It's just the level of adoption and trust. They're not there yet, and people are running the industry the way they used to be, and they're frustrated. and the solution providers are frustrated because it's also not moving. So where's the bottleneck is, that's the biggest question, right? So I think we need to get into the root of this and move something. And there are also people who came here and say, my mission is to also bring technology and reduce the fear and make it more feasible, make it more trustworthy, so that we can move this needle together, because this industry is one of the industries that has a lot of potential because it's not cracked yet, and at the same time it can get worse or get better. In the next decade we will have a lot more old people. We need more other people who have skills in healthcare, medical doctors, nurses, to cater to that. And our generation will be the one who's also pushing that. So we need people and technology at the same time, and that's unavoidable. It's just a fact. It's just a ticking time. Neat.
Yeah, let's pull in. If you have, let's do it together as much as we can. Like everyone who wants to champion this,
Yes,
like we got your back. Like
we
just
gotcha.
reach out to us. We will do everything. We will do it for free. Even I tell you, I will do it for free. I don't care anymore. Anyways, so
All right.
man. Okay, good.
Pretty passionate here.
Yeah, yeah. I'm like beaten up at one time. At the other time, I also think like, come on, let's change.
We can
Anyways,
do this. I think we can do this, and I've seen it more and more. The more we talk to people, the more we understand they are also trying their own ways.
mm,
They're already doing their own projects. It's just that they have bottlenecks. So I think we need to pull the right mindset, pull the
yeah.
right people in the same, organization, same ecosystem, that we can do this together. I feel it's a lot of potential.
All right, we can do this together. This is our final word, and yeah, as always, stay a friend of our show. Hope you enjoyed it for this time. Like, subscribe, comment. Maybe you have the perfect idea how to crack the nut. Then yeah, well, put it in the comments whatsoever. Engage into the discussion.
Yes.
Always happy. And then we see you next week
See you
at
next
the
week.
Aiku Show.
Yay! Ciao. Aiku. What I can do.